Investigation into the death of 57-year-old Muslim man who died on a train last Monday. Prachuap Khiri Khan, the 57-year-old, arrived in the early hours of Sunday morning on a flight from Islamabad. He was issued a medical certificate from a hospital there dated March 26 which specified that he was free from the COVID-19 virus. 19 students on the flight were subsequently quarantined, but Mr. Anand Soho's temperature on arrival was found to be normal. On Friday, Thailand recorded 4 more deaths from the virus with 103 new infections. Most who died were elderly. Thailand's Immigration Bureau has tracked down all immigration officers involved in the screening of a Thai man who returned from Pakistan on a flight into Suvarnabhumi Airport on Sunday. Details of the case were presented on Friday by Immigration Bureau Chief Lieutenant General Sampong Chingwang. The 57-year-old man subsequently died on the number 37 train from Bangsu to Sungai Kalak on Monday night shortly after being urged by railway personnel to disembark after his obvious ill health caused them to test the man at Hua Hin station en route. The 57-year-old Thai man who died on a southbound train at Top Sake railway station in Prachuap Khiri Khan on Monday night flew into Thailand from Islamabad in Pakistan after being issued with a fit-to-fly letter from a hospital in Islamabad, the capital of Pakistan, dated March 26. The man, named as Anand Soho, arrived in Thailand on Sunday, March 29 at 5:50 a.m. on flight TG 350 and cleared screening at Suvarnabhumi Airport, even though he later requested a wheelchair at the terminal. The flight to Thailand had 279 other passengers, many of them students returning to the kingdom. 13 students may have interacted with the man. The head of Thailand's Immigration Bureau, Police Lieutenant General Sampong Chingwang, presented details of the case on Friday. 6 immigration officers at Suvarnabhumi Airport are being kept under observation as they have been identified as being involved in the clearance of Mr. Anand on his arrival last Monday. 13 students returning on the plane are also thought to have had contact with the man. Railway personnel placed in quarantine. Earlier, the State Railway of Thailand confirmed that 11 of its staff, including those on the train and platform personnel, have been ordered into 14 days quarantine after they may have also been in contact with the ill-fated train passenger. Mr. Anand visited Bangsu Central Station twice, once on Sunday morning and later on Monday afternoon when he boarded his train. Students ferried to hospital and quarantined as they had temperatures in excess of 37.5 degrees. Today, a spokesman for the Immigration Bureau disclosed that 13 students on the flight that arrived early last Monday morning had temperatures exceeding 37.5 degrees and were ferried to a hospital to be held in quarantine. These details were given by Police Major General Shurafong Chukan, the deputy head of the Immigration Bureau. 57-year requested a wheelchair while waiting for his luggage at Suvarnabhumi and was wheeled to a taxi. Mr. Anand passed the screening but requested a wheelchair while waiting for his baggage due to the extended queue. The Deputy Director of Airport Operations at Suvarnabhumi Airport revealed that the passenger was limping as he waited for his baggage. He was later wheeled across the terminal by an airport official. He then hired a taxi and left for central Bangkok sometime after 6 a.m. Today, officials revealed that the worker involved and the taxi driver which took Mr. Anand from the airport have been tested for the COVID-19 virus and results are expected shortly. State Railway Director shows footage of the man coughing near a passenger at Bangsu. The director of the State Railway of Thailand, Thakunantarakam, later revealed that CCTV footage at Bangsu Central Station on Sunday morning after 10:27 a.m. showed Mr. Anand engaged in a coughing fit in the proximity of another passenger. The railway executive indicated that it appeared that Mr. Anand had coughed on the passenger, but later the man in the video contacted the state transport company to dispute this. Nevertheless, he has been asked to quarantine himself as he is at risk of developing the infection. Stayed in a Muslim hotel in Bangkok on Sunday night. Mr. Anand was at the railway station to book his ticket on the train for Monday when he was captured on the security footage. The man was seen on footage to be in a physically compromised position and appeared to have difficulty in walking and standing up for long periods of time. He then left by taxi and headed to a Muslim hotel on Swaran Konding 59 in Bangkok. He stayed at the hotel overnight before setting off on his final journey on Monday afternoon. Boarded train south at 3:34 p.m. on Monday. He boarded the Bangsu to Sungai Kalak number 37 train at 3:34 p.m. and occupied seat No. 28 as the train departed. By the time the train reached Bangpong station in Ratburi, he had begun to cough and display symptoms. At Hua Hin Station in Prachuap Khiri Khan, he was examined and staff found his temperature to be 36 degrees. Advised by staff and railway police at Hua Hin Station to disembark but declined, found dead later. He was advised at that point to delay his journey, disembark and seek medical attention by very concerned train staff who called in the railway police and train staff to screen the passenger. The staff member that tested the man's temperature had a hazmat suit while railway police observed. The screening of the man on the train was also reported to be limited by the necessity for the train to keep its timetable. It is understood that the operation took just 3 minutes. Staff at the scene were noticeably aware of the man's poor health and weak physical condition according to later reports. His body was found near the restroom at 10:15 p.m. by passengers as the train arrived at Top Sake Station. Doctors later confirmed that the man had died from a diabetes-related condition and other diseases while also advising that he had tested positive for the COVID-19 virus. Thailand announced the largest number of deaths so far at 4 on Friday, most of them elderly people. On Friday, Thailand announced its highest number of deaths for the COVID-19 disease so far with 4 fatalities and 103 new infections. One of those who died was a 59-year-old employee of the State Railway of Thailand who had no underlying conditions. The man fell ill on March 16 last with a fever and his condition became critical on March 31. 2 of the fatalities were elderly Thai men, both 84 years of age who had attended the Rajadamnern Boxing Stadium in Bangkok. One fell ill on March 18 and was admitted to hospital on March 21 with 39-degree fever and other symptoms. He died on Thursday. The other man suffered from kidney disease, hypertension and gout. He was admitted to hospital on March 26 and died also on the same day. The 19th victim was a 72-year-old man who contracted the disease from one of his children who was at the same boxing stadium. He had a kidney condition and fell ill on March 16. He passed away on Wednesday. A spokesman for the COVID-19 center urges Thai people not to greet parents and elders this year. Dr. Taisan Visanu Yothan of the COVID-19 center gave Friday's briefing and used the occasion to urge all children not to greet elderly parents as usual during this emergency despite Thai tradition and culture at this time of year for Songkran. He also identified that many of those infected are between 20 and 29 years of age because they tend to have busy and active social lives. From today's briefing, it also seems that the number of infections appears to have swung back towards Bangkok, which now accounts for 53% or the majority of cases again in the kingdom. Approximately 10% of those infected are foreigners, but this number is declining. Further reading. Man returning from Pakistan dies with COVID-19 virus condition on overnight train heading south. Emergency could be extended as more people present themselves at hospitals due to the virus. No need for further measures in Bangkok, says COVID-19 center spokesman as provinces take steps. Monday's figures include 2 more virus deaths as emergency COVID team calls for fewer commuters. Still a chance to avoid a curfew or a lockdown if the public stays at home over the coming 7 days to quell virus. 24-hour curfew in the works as the government puts curbs on national travel with checkpoints on roads.